Good afternoon. My name is Melissa Robinson, health educator, presenting to the Bill and Melinda Gates Foundation about suicide prevention in young girls. Suicide is a public health problem for all age groups, but it is increasing for adolescent girls ages 10 to 14. The increase in suicide rates among adolescent girls is continuing to climb. According to the CDC, suicide rates were at an all-time high in 2015. Between 2007 and 2015, suicide rates doubled for adolescent girls. Girls are particularly vulnerable because they often suffer silently. The suicide rate for girls ages 10 to 14 has increased to 1.7 out of 100,000. Suicide is a complex issue, especially for young girls. An effective program targets young girls beginning at 10 years of age. The goal of an educational program is to help young girls recognize the warning signs surrounding depression and feelings of suicide, and giving them the tools to ask for help for themselves or another person in need without shame or feeling stigmatized. Intervention is key in preventing suicide attempts. Suicide rates among young girls is on the rise, with contributing risk factors that include mental health, social, and environmental issues. Risk factors include unstable mental state, anxiety, depression, family life issues, abuse, bullying, social media, and financial instability. Considering the interpersonal level of adolescence relating to suicide risk is important. By looking at what risk factors and what protective factors each individual has, it allows for tailored planning and development of specific suicide prevention programs. Risk factors such as unstable mental and emotional state, family issues, along with social problems can put adolescents at risk for suicide. Adolescents today face many challenges, including bullying, either online or in person, often leading to feelings of hopelessness, depression, and coping mechanisms that include substance abuse. Traumatic events in a young person's life can have lasting effects that can make a person high risk for suicide. It is important that the stigma surrounding these risk factors be dissolved and not judged, but instead give adolescents the support and acceptance needed. Gaining help should feel safe and comfortable. Proposed interventions: Teen Screen, SOS, the CAST program. Evidence-based programs such as Teen Screen, SOS, and the CAST program are multidimensional approaches to prevent suicide in teenagers and can be specifically tailored toward younger adolescent girls. It is the goal of all suicide prevention efforts to reduce risk factors and increase protective factors. Programs must be selected carefully because there is not just one solution to suicide. Suicide is a complex problem and has many dimensions to be touched on. By using evidence-based practice framework that are based off of best practices and are considered the best choice for promoting health, suicide prevention programs can be successful. Teen Screen. Screening teenagers for mental health issues can give insight to the tendency to attempt suicide. Settings where screenings can be found include schools and health care centers, medical settings such as a doctor's office, shelters, community centers, clinics, treatment facilities, and juvenile justice environments. Screening is an important tool because it can identify mental illness early on in an individual, possibly at a younger age, so help can be achieved at a less critical stage. The SOS program was designed and has proven to prevent suicide by giving students the power and knowledge to curb suicidal behaviors, along with changing the way that young people think about suicide and mental health issues. This evidence-based program has shown a reduction in suicide attempts based on random controlled studies. The SOS program is different in that it has two main parts. The first part is a curriculum that teaches about all aspects of suicide prevention, while a second part screens students for the risk of depression. The CAPS program is NIH funded and is school-based. The duration is 12 weeks and small groups meet. Intervention efforts include social support and building positive outcomes. There is evidence that the CAST program promotes positive outcomes. These include lowering high-risk behavior, increasing problem-solving and coping skills, along with lowering anxiety and depression. The CAST program does a good job at promoting peer and adult support systems. This program is adaptable to meet the needs of younger adolescents. It is important to look at the design and framework relating to suicide prevention efforts. Each prevention program has a different approach to prevent suicide in adolescent girls. Assessment, data collection, and measurement are important to ensure that programs are meeting the needs of participants and using funds to promote positive health outcomes. Evaluations assist in making programs better to fit the needs of participants. Developing and implementing an effective program is essential when regarding suicide because it can mean the difference between meeting vital goals, improving the program, and attracting stakeholders. Potential challenges or barriers include creating programs that appeal to teenagers, gaining permission from parent or guardian, stakeholder engagement, funding, location of programming. Possible solutions include mobile apps or online programming, local support groups, school community centers, etc. The process of creating a suicide prevention program such as SOS, CAS program, and Teen Screen for adolescent girls needs to include ample funding. Funding can be gained from the federal government, SAM, HSA, National Institutes of Health, and the CDC. Funds would go towards supplies and trainings to support suicide prevention. Materials created would specifically speak to and educate a younger demographic. Training would be provided for those supporting the efforts of a suicide prevention program. Since these programs are school-based, permission from parents and administrators would need to be granted to move forward. Those involved in screening and teaching would need to also become familiar with data analysis methods. Outputs of the process would include increased knowledge of suicide, mental health issues and warning signs, skills to communicate with adolescent girls, along with promoting students to seek help and use peers as a support system. Outcomes would include identifying adolescents at risk and providing referrals for the next step of care. Outcomes would also help improve self-esteem, create a safe environment, remove the stigma around seeking help, and promote community awareness. The impact of these systems would reduce suicidal tendencies and suicidal behaviors. Recognizing the warning signs of suicide needs to be emphasized. Exercises in self-esteem building and navigating social situations need to be part of any program. Screening questionnaires need to be available for each adolescent to assess and identify if they are considered high risk. Additional resources and referrals would be available so that a more advanced assessment could be made along with treatment options by a therapist or other medical professional. Teaching prevention strategies along with creating peer support groups is essential to reduce risk. Education materials would be designed to be versatile at school or in a community setting. The ability to reach young girls and give them active strategies along with support services such as crisis lines, peer support groups, and timely interventions to reduce suicide in a positive, effective way is vital. It is important to focus on the individual, social issues, and the education in the community to provide the necessary protective factors that can save lives. Thank you.